On to pivot pass.
On to pivot pass. Here we go. So we already did the ulna, so now we're going to slide into the radius. So if we move over to, just to get your bearings, you need to find the olecranon, then find your lateral epicondyle. Instead of remaining in anatomical position, we're probably, as we move more distally, going to ask Dr. K to shift into pronation. So, but let's start here so that way you can actually feel the head of the radius. As you come, it's really the only bony prominence that you're going to feel if you come just a little bit distally from your fold in your forearm. You're going to feel. So take your thumb and your forefinger and you're going to feel. So kind of push up and down on that. So glide that head of the radius superiorly and inferiorly, and you'll start to feel that there's movement in that. What's awesome about this bone is that it is cylindrical. So you're going to actually feel, as your patient pivots, that you should feel movement underneath your hand of the radius. And you'll also feel that the ulna slides into that, allowing your forearm to pronate and supinate, kind of special to this area of the body. So if we now slide down, and we slide down to the shaft, we'll notice that on Dr. K it starts to become more prominent as we move down. We would expect that, a lot more soft tissue up top. So we're going to slide down. You're going to stay just on this aspect so that you can slide right into that radial styloid. You will notice, right, that it's not as prominent as that ulnar styloid, but still very important. A lot of structures pass through and around your styloid processes. What we want to come to find, though, is that we now have a radial styloid, but we're going to look for what's called Lister's tubercle. So if you slide about 1/3 medial, you're still on the radius. You're not moving over to the ulna, so you're still on the radius. And if you ask your patient to extend, so now you're on the extensor pollicis, yeah,
longus.
There you go, what Dr. K said. You'll start to see that this is actually a hook for that tendon to go around. So as we move into more impairments that involve the wrist and the hand, important to know this bony landmark is highly involved with that. Especially nowadays as we start to text more, where do we think we put more stress? We tend to get more stress in this aspect of where our thumb comes in, especially as we move into the carpal metacarpal area. So knowing where our styloids are, where Lister's tubercle is, gives us actually a jumping off point for our carpals. So stay tuned. That will be our last trail guide for the